Hey everybody, it's just Justin coming back at you after a long period of time with a new video. Kind of changed a little bit after a little period of time of not being on my channel, and you probably have all noticed, but hey, that's what happens during COVID. But yeah, I decided to grow the beard out finally. This video is called The Life of Personal Support Workers Part 4. Or The Life of a Personal Support Worker Part 4. I've done 3 videos before in the past, and I decided to come on here to do another one because I haven't done one post-COVID. So yeah, I just wanted to tell you guys about some of the changes that have happened recently. So, Life of a Personal Support Worker, if you want to watch my little series, go back on my videos and just take a look. So anyways, like before in my last videos, I talked about the things we did as a personal support worker and a whole bunch of other things too. But things have honestly changed, especially in the home care and the healthcare industry for the last couple of years, ever since COVID's been around. And some of those changes have taken place, especially with the frontline care. Now, in home care in general, before COVID, we used to not wear masks to face-to-face visits with clients, and we never had what we call screeners right now. So what they are is we do our visits, and we have to pre-screen, and if the clients show any symptoms, we have to now, or if they are definitely COVID positive, if they're taking a rapid test and they know they are COVID positive, we have to wear a PPE, which is that yellow or it could be blue gowns. We have to wear goggles or a face shield, the mask, like a surgical mask, but it is recommended to wear an N95, obviously, and also you're wearing gloves, obviously, during care. I always do that anyways, wear gloves during care anyways. Yeah, like you're doing that, and then at the end of the visit, you have to dispose of them in a garbage bag and wipe down your other stuff like the goggles and the shield, wipe it down, and then off you go and stuff. And yeah, like that's one of the things that has changed doing frontline care visits. Now, in hospital settings and long-term care settings, it would probably be patient to patient. So afterwards, they would have to dispose of things and then do it for the next patient, though, too. And more precautions like that, probably more testing. If you are COVID positive, you have to stay off. I think it's between 5 and 7 days now. They've limited it to. Before it used to be 10, and then you would have to rapid test until you're negative, and then you can come back once you're cleared. Also, going back to face-to-face clients, if they are COVID positive now, what we have to do is after 10 days too, like we don't have to wear the gear anymore unless they are still COVID positive. Yeah, so that's the things that have changed. Another thing that's changed also too is we can't just call in sick anymore too. So before, like if you were sick or you just wanted a day off and you call in and go, I'm sick, not feeling well, you come back in a day or two after having a day or two off. Can't do that anymore though too. They're gonna expect like you'd have a negative rapid test. If you say to your boss or your manager that you've been in contact with possible cases of COVID, or you had people who showed symptoms, they're going to make you stay off. And some of them can be real jerks about it too, but then they'll just say, I'm following the new safety protocol procedures through Health Employment Standards Canada. So I just think that it's a bunch of in-house policies, and you want to know something, it's ridiculous. Like in this industry, you got to be careful, especially with seniors and the very vulnerable, you know what I mean, people with compromised immune systems, because that's the thing though too, you know what I mean, like even though they've been vaccinated, people who still have compromised immune systems, like if they've had cancer treatments or they've had an illness and their immune system's compromised, they're wide open to like infection, getting sick, and especially getting COVID, and that's something you just don't want to risk and stuff. So I understand that completely. Will this stuff disappear after COVID is actually finally over? I have no clue. Will things go back to the way they used to be too? Will be able to call in sick and go, take a day off and not have to worry about this rapid test stuff? I don't know. And especially with the masks, you know what I mean, frontline care. Hey, you want to know something too? I have a feeling clients are going to expect us to wear those from now on too, but I don't know, lots of things have changed. So, and that's basically now, that's a life, the day in the life of a personal support worker, doing things now when we have COVID and stuff. And yeah, you know what I mean? And we got to fill out a whole bunch more paperwork now if something happens. We get bombarded with even more information and updates on things, on what's happening and stuff. And, like, that's just the way things are now. So it's unfortunate, you know what I mean? And a lot of people are actually not wanting to work in this industry right now, or have stepped away from it. Their reasoning is because they don't like the restrictions I just said. The other reason is the vaccinations, and that's another thing though too. I know pretty much probably the vaccine policies are still in place, that if you have to work for some places, especially if you're working in a long-term care and hospital, you definitely have to be vaccinated. And I think that's also keeping a lot of people away, because people don't want to get vaccinated, who want to get in healthcare. They don't want to do that. But at the end of the day, it's everybody's choice again, though, too. What can I say? There are people out there who think this is all some kind of hoax, or, like getting jabbed is such a bad thing. But, I'm not an anti-vaxxer. I'm not anti-anything, you know what I mean? Like, I believe in the science because I am in healthcare. I've been in healthcare for 13 years. I understand things. I study things. I educate myself properly. And, I do help in the medical field, and I've also taken care of current and former medical professionals as well, too. So, you want to know something? Information comes my way all kinds of ways, too. Plus, we always continue in our education, too. So, I'm always learning new things. So, vaccinations do help alleviate the more harsher symptoms, but you can still get sick. And then that's the important thing. But you also have to remember, at the end of the day, it is your choice, and I understand if it's your choice. But also, you have to take into account that there are other people out there who are vulnerable, like seniors, young children, and people with deficient immune systems. And I'm just trying to tell everyone here that they are at the highest risk. And I would not want to see anything happen to those kinds of people who are in those categories, because you know what? That's not cool, you know what I mean? And I just want to make sure that everyone's safe and everyone's sound and secure. Because remember, it could be your loved one, could be someone you know, and I wouldn't want anyone to feel guilty for doing something they didn't intentionally want to do in the first place, okay? Anyways, folks, you guys take it easy. Take care now, and I will talk to you soon. Bye for now.